What are psychedelics? What do you know about the drugs against anxiety, depression? What are the adverse drug reactions of drugs modulating the serotonin receptors? What happens when excess of serotonin is there in the body? All this and much more will be detailed out in today's episode. Welcome all to ispharmacologydifficult podcast. I'm your host Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. So let's go for the first question. What are psychedelics? Hallucinogenic drugs, which primarily act on 5-HT2A receptors, are the psychedelic drugs. Let's get this definition of psychedelics more sound and clear. These are the substances which are occurring in nature and they are naturally derived from the nature. They belong to three most important families, namely phenethylamine. The example is mescaline. Second, tryptamine. Example is psilocybin. And thirdly, ergot alkaloid derivatives. Example is capital LSD. And nowadays, modern synthetic psychedelics, they are also in vogue. Along with the activity on 5-HT receptors, additionally, activity on dopaminergic receptors and adrenergic receptors is also seen. These drugs are now recently used in therapeutics. Where and how, let's get to know. In the treatment of anxiety, depression, obsessive compulsive disorder, migraine, etc. Their possible mechanism is the heightened synaptic connectivity. And the main mechanism or the core mechanism is still quite under research. There has been much known about the animal research models. Psychedelics in the animal research models, they are used in the treatment of the inflammation disorders like asthma, ocular ailments, and even the cardiac ailments. Now let's shift our focus to the other drugs in the list today for the episode. We have drugs for anxiety and depression. Selective partial agonists at 5-HT1A receptors like buspirone, gpirone, ipsapirone. They are quite effectively used as anti-anxiety drugs. Selective serotonin reuptake inhibitors, the capital SSRIs. They are wonderfully useful in the treatment of depression. Citalopram, one of the SSRIs. It elongates the 5-HT or the serotonin action, which is when released by the neuronal activity. SSRIs like fluoxetine, fluvoxamine, citalopram, escitalopram, paroxetine, and sertraline. They are the most important drugs indicated for the major depressive disorder. Vilazodone, it is also an SSRI. It's a partial agonist at 5-HT1A receptor, and it has a unique mechanism of directly activating this receptor. So it has a quick onset of action. Another drug, viloxazine. It is indicated for attention deficit hyperkinetic disorder in children, and it is also indicated for depression. Its mechanism has been worked up recently. It shows antagonism at 5-HT2B receptor and agonism at 5-HT2C receptor. Now, let's turn the side of the coin. We cannot turn away our faces from the adverse drug reactions of SSRIs and SNRIs. That is, selective serotonin reuptake inhibitor drugs and serotonin and norepinephrine reuptake inhibitor drugs. The most important side effect is the sexual dysfunction or disorder. The major examples are erectile dysfunction, decreased libido, anorgasmia, etc. The mechanism of such kind of adverse drug reaction is still under work, that is in process. On the contrary, There is one of the drugs, flybenserine. It is agonist at 5-HT1A receptors and antagonist at 5-HT2A receptors. This is actually approved for the treatment of hypoactive sexual desire disorder, that is capital HSDD. Especially it is occurring in the premenopausal women. Now such a use or administration of flybenserine decreases the 5-HT or the serotonin levels in the cortex, while it increases the dopaminergic and adrenergic drug levels, that is the levels of dopamine and norepinephrine. Now this redistribution of monoamines is the suggested mechanism of action of this drug. Now next in our list are the drugs for the psychosis. Without any delay, let's get to know the name of the drug first. Pimavanserin. Now this drug is very effectively useful in treating hallucinations and the delusions that occur along with the Parkinsonism and also the associated psychosis. How would you get to know about the mechanism of the drugs? Well, the mechanism of this drug unfolds something like it's a selective inverse agonist at 5-HT2A receptors. It has a comparatively much higher selectivity at 5-HT2C receptors. Now, it serves much better than other antipsychotic drugs available in the market, especially for the psychosis associated with Parkinson's disease. Why? Because all other drugs, they additionally block the dopamine receptors and thereby they worsen the motor symptoms associated with the disease. So, pimavanserin, it is specifically useful in the psychosis associated with Parkinson's disease. Elsewhere for psychosis, the efficacy of this drug is yet to be determined. Lastly, let's wind up our talk with the talk about serotonin syndrome. What is serotonin syndrome? Well, in a very simple language, I would say that when the levels of serotonin or 5-HT increase much beyond in the body above the acceptable levels, then the condition is known to be serotonin syndrome. And why it happens and when it happens, the possible conditions are fresh antidepressant medication or therapy or very high doses of antidepressant medicines. Secondly, administration of the combination of capital SSRIs with norepinephrine reuptake inhibitor or with triptan, that is in case of migraine. Then sometimes when the conditions they are not suitable and they are not suiting the patients, it may result in serotonin syndrome. The mechanism most commonly involved for the serotonin syndrome is the hyperactivation of 5-HT2A receptors and also 5-HT1A receptors. And the signs and symptoms include restlessness, confusion, diarrhea, increased heart rate, muscle twitches, fever, convulsions, loss of consciousness, and even in certain severe cases, it can result in death also. Now is the right time to seize my speech. In the next episode, we're gonna talk about a new story of dopamine and that gonna unfold. For all the updates and latest episodes of my podcast, do visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It contains a lot of updates about medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, is Pharmacology Difficult. If you're listening for the first time, do subscribe and follow whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.